The Nipah virus is a rare but severe threat. It does not spread easily like common respiratory infections, but when it does emerge, the consequences can be devastating. With a high fatality rate and no specific antiviral treatment, Nipah represents one of the most dangerous zoonotic viruses known to public health. While everyone should be aware, certain groups face a significantly higher risk and must exercise extreme vigilance. First, those living in or traveling to outbreak regions. If you live in, work in, or visit areas where Nipah virus cases have previously been reported, particularly parts of South and Southeast Asia, your baseline level of awareness must be higher. These regions often overlap with the natural habitat of fruit bats, the primary reservoir of the virus. Fruit bats can carry and shed the Nipah virus without appearing ill. The virus can be present in their saliva, urine, or droppings, contaminating food, water, or surfaces without obvious warning signs. This silent transmission makes prevention especially challenging. For people in these regions, simple daily practices covering food, washing fruits thoroughly, avoiding exposed water sources are not optional precautions but essential safeguards. Second, people with high exposure occupations. Certain professions face repeated or direct contact with potential sources of Nipah virus, placing them at much higher risk. Farmers and agricultural workers who harvest fruit or work near orchards frequented by bats are among the most vulnerable. Fruits partially eaten by bats or contaminated by bat secretions can become a hidden source of infection if consumed or handled without protection. Date palm sap collectors face an especially well documented risk. In multiple outbreaks, the consumption of raw date palm sap contaminated by bats was identified as a major transmission route. Drinking raw, unprotected sap in endemic regions is not simply unsafe, it is a known and preventable risk. Livestock handlers, particularly pig farmers, also face elevated exposure. Pigs can act as intermediate hosts, becoming infected after contact with bats and then transmitting the virus to humans. Close contact with sick animals, cleaning animal enclosures, or handling livestock without protective equipment increases the likelihood of infection. Wildlife rehabilitators, researchers, and field workers who handle bats directly are among the highest risk groups of all. For them, strict biosafety protocols are essential at all times. Even a brief lapse in protective measures can have serious consequences. Third, frontline healthcare workers. Doctors, nurses, paramedics, laboratory personnel, and hospital support staff stand at the front line during any Nipah outbreak. Human to human transmission has occurred repeatedly in clinical settings, often before the disease was recognized or confirmed. Without strict infection control, proper use of personal protective equipment, isolation protocols, and careful handling of bodily fluids, the risk of transmission in healthcare environments is real. Healthcare workers must maintain a high index of suspicion when treating patients with fever accompanied by neurological or respiratory symptoms, especially in regions where Nipah is known to circulate. Protecting healthcare workers is not only a matter of individual safety, it is essential to prevent hospitals from becoming centers of further spread. Finally, family members and caregivers. Nipah virus can spread through close physical contact with an infected person's bodily fluids. Family members caring for sick relatives are often exposed during the most critical and contagious stages of illness. In previous outbreaks, caregivers became infected simply by providing basic care, feeding, cleaning, or remaining close to loved ones. Compassion alone is not enough. Protection is not optional, it is critical. Masks, gloves, hand hygiene, and adherence to medical guidance must be followed rigorously. For all high-risk groups, caution is not a choice, it is a necessity. Recognizing symptoms early is vital. Warning signs may include sudden fever, severe headache, muscle pain, cough, vomiting, or confusion. In some cases, the illness progresses rapidly to respiratory failure or encephalitis, swelling of the brain, which can be fatal. Anyone experiencing symptoms after potential exposure should seek immediate medical attention and avoid close contact with others. Practice strict hygiene. Avoid consuming raw date palm sap or uncovered foods. Do not handle sick animals without proper protection. Follow public health guidance without delay. The Nipah virus reminds us that preparedness saves lives. Awareness is our first defense. Precaution is our strongest shield.